Good morning, dear BCMCH family. Welcome to one more Quest session on Thursday morning. So it's a great privilege to have all of you here. And before we start the proceedings, may I request our chaplain, Achin, Reverend Father Thomas Varughese Achin, to start with a word of prayer. Achin.
പ്രാർത്ഥിക്കാം. നമുക്ക് എഴുന്നേറ്റ് നിൽക്കാം. പിതാവിനും പുത്രനും പരിശുദ്ധരുഹായിക്കും സ്തുതി ആദ്യം നീക്കം തന്നെ. ആമേൻ. സ്വർഗസ്ഥ പിതാവേ, ഞങ്ങളങ്ങേ സ്തുതിക്കുന്നു. Another Thursday, 16th February 2023. ഈ ദിവസം ജീവിക്കുവാൻ ഞങ്ങൾക്ക് തന്ന ആയുസ്സിനും ആരോഗ്യത്തിനുമായി നന്ദി. ഇന്ന് വീണ്ടും പുതിയ പുതിയ കാര്യങ്ങൾ കേൾക്കുവാനും ഗ്രഹിപ്പാനും പുതിയ തലമുറയെ എങ്ങനെ ഞങ്ങൾ ജീവിക്കണം എന്നുള്ള കാര്യങ്ങളെപ്പറ്റി ഒരറിവ് കൂടെ കിട്ടുവാൻ ഞങ്ങൾക്ക് ഇതുപോലെയൊരു സെഷൻ ഞങ്ങൾക്ക് ലഭിച്ചതോർത്ത് നന്ദിയും സ്തോത്രം അർപ്പിക്കുന്നു. ഇന്ന് അത് ഹാൻഡിൽ ചെയ്യുന്നതായിട്ട് ഡോക്ടർ ദീപക്കിനെ പ്രത്യേകമായി അവിടുത്തെ കരം കണ്ട് കേൾപ്പിക്കുന്നു. അവിടുത്തെ സാന്നിധ്യം കൂടെ ഇരിക്കണമേ. അവിടുന്ന് ആഗ്രഹിക്കുന്നതൊക്കെ ഞങ്ങളോട് കമ്മ്യൂണിക്കേറ്റ് ചെയ്യുവാൻ അദ്ദേഹത്തിന് ശക്തിയും ബലവും കൊടുക്കണമേ. വന്നു ചേർന്നിരിക്കുന്നവരെയും വരുവാൻ ആഗ്രഹിക്കുന്ന ഓരോരുത്തരെയും കൂട്ടിക്കൊണ്ടുവന്ന് ഞങ്ങൾക്ക് ആദായകരമായ ഒരു സെഷൻ ഇതായി തീരുവാൻ സഹായിക്കണമേ. പ്രാർത്ഥന ഘട്ടത്തിനായി നന്ദി. യേശു ക്രിസ്തുവിൻ്റെ നാമത്തിൽ തന്നെ ആമേൻ. പ്ലീസ് ബി സീറ്റഡ്.
Thank you, Achin. Artificial intelligence in healthcare. Today's topic is extremely pertinent. The very fact that Elon Musk, one of the most known persons on the planet today, has said artificial intelligence is the game changer of the century. Be it positive, be it negative, be it in the affirmative, be it in the negative. It is the one single game changer, and it is not going to be otherwise in healthcare. So to talk to us about it, we have none other than a brilliant community health physician and an amazing musician in our midst, Dr. Deepak Varughese. So he graduated from CMC Vellore in community health, and he's been with us for the last 1 year. So let us put our hands together and welcome Dr. Deepak Varughese as he elucidates about artificial intelligence.
Check. Yeah. Thank you, Jacob sir, for that very kind introduction. Yeah. So I think the topic. First of all, I want to put everybody at ease here. This is not intended to be, statistics heavy, very technical talk, full of jargon and full of scary sounding words. That's not the intention. So rest assured, this is a talk that is meant for the health, I would say the physician community, but also to everybody involved in healthcare, because this is, like sir was pointing out, that AI is a topic that we're hearing about so much more, and so this is essentially it's meant to be a primer and to understand artificial intelligence in today's age. Okay, so I think I have 3 objectives today. That is, one, lot of the times we hear a lot of controversy about artificial intelligence. So much of, it's not a topic that you can just open up on the internet and read one particular view, because if you go online, there are 10 different views by 10 different people, and it becomes difficult to get a certain point of view and to make your own judgment about it. And so there's a lot of, there are a lot of people who take a lot of extreme positions. So one is, if we understand AI, it kind of removes the fear of the unknown, and it helps us to be, to understand, to interact with that, the thing with we're reading with a little more confidence, right? So that is one. Second is to have a realistic picture of how AI is likely to progress in the near future. Obviously, nobody knows exactly how it is, but how it is likely to progress in the near future, and to make informed choices about AI in today's decisions, right? Okay, so usually when we hear the word artificial intelligence, machine learning, there are among the the physician among the doctor community, there is two extreme positions. Yeah, some people will be like, AI is going to solve everything, or it's going to, not among the doctor community, but in general, when it comes to AI in healthcare, there is one group of people who say that AI has no place in healthcare. This is purely clinical traditional medicine. And there's another group of people who are generally not from a clinical background, who say that AI is going to completely upturn the system upside down, and doctors are going to be irrelevant and all of that kind of things. But I think both are two extreme positions. So I think hopefully by the end of the talk you'll realize why both these extreme positions may not necessarily be true, and make a better decision for yourselves as to what you would like to think about it. Okay, so anytime you hear the word artificial intelligence, it's a very big sounding word. If somebody's talking about AI, they will be like, this guy is talking about some very, very complicated things. And that's the whole picture of robots, and that's the mental image we get in our heads. But really, that's not what it is. What if we look at the applications that are leveraging artificial intelligence, if you look at the industry that is leveraging artificial intelligence today in today's world, it looks like things that we already use, right? Gmail, Netflix, all your social media platforms, whether it's Amazon's Alexa, Siri, whatever, all of those, it is already embedded in our lives in so many ways that it's futile to say that we will not engage with it. How it is used, I will explain a little later, but it is not this scary futuristic picture that we're talking about. I'm talking about a very realistic today kind of point of view, because all of this is already what artificial intelligence is today. Okay, so we're going to look at it, just get some concepts out of the way, look at some non-medical concepts so that we're clear, and then some medical concepts, and then how do you generally evaluate it, and then looking to the future. So that's generally the structure which we're going to do. Okay, so before we get into artificial intelligence per se, there is a huge industry today called data science, where you have a couple of things. That is, one is you have the domain. It's basically data science encompasses statistics and research methods, domain knowledge. That traditionally, when you talk about data science, you talk about it as business knowledge, but in the healthcare setting, it's knowledge of medicine, and then there's some programming and computer stats related things. So when that comes together, you have an emerging field of study called data science. Okay, data science is a very evolving but fastly evolving field of science that we have today, but it is a game changer. Artificial intelligence can be, is something that is worked on by data scientists, but I think this is where the community medicine angle comes in, because we traditionally already have some domain knowledge of medicine and stats and research, so it's essentially just the programming that is coming in. So I think there is some amount of overlap between what we do and what has traditionally been the community medicine point of view, and what is today being called data science. So I think there is some overlap, but I think traditionally biomedical research has been along these two axes, but I think with programming and coming in, I think it's changing the way that uh, the way we process data is changing, because the amount of data that has been available to us in the last decade is more data that has been generated ever in human history. So I think there's so much volume of data and so much processing power that has come, because processing power in terms of computers has become much cheaper than what it was before, so it's affordable and accessible. Okay, this is just a quote that Uber is the world's largest taxi company. They owns no vehicles. Facebook is creates no content. So today, if you look at all the big companies in the world, Uber, Facebook, I mean, now it's Meta, I guess, and Airbnb, they don't own physical assets, but what they do is they control the data. Because what Uber is essentially, people think of Uber as a taxi service. It's not. Essentially what it does is it's a data controlling, data science is what they do, because what they do is they connect the end user. I mean, they know who wants the service, they know who provides the service, and they can give you that information in real time. So all of these things, all of these people, their strength is data. It is not necessarily the industry that they're in. So I think this is the way the world is progressing. So I think can healthcare be far behind? So getting to that part of artificial intelligence and machine learning is like getting to definitions. The words artificial intelligence and machine learning are often used synonymously, but what's important to remember that artificial intelligence is a very broad term. It's more of a for a lack of a better this thing, I mean, it's more of the goal or the broader framework around which all of this exists. But the core actual thing that's happening is machine learning, right? So if you look at technical documents, they're all documents on machine learning, whereas artificial intelligence is kind of like the overall goal, right? So ML is what. That's why in a lot of documents you will see the words AI/ML, that is artificial intelligence/machine learning, because machine learning is the actual part of it. It's the heart and soul of what artificial intelligence is. But artificial intelligence is the broader term, So there's a popular joke in the community where they say that artificial intelligence is, machine learning is written in a programming language, whereas artificial intelligence is written in PowerPoint, because artificial intelligence is the marketing part of, you put the word artificial intelligence up there, it's more likely to be hyped rather than putting the word machine learning. But essentially they are a very similar structure. So if you look at machine learning, the core, the definition is, it's a very complicated definition right now, but I will break it down step by step, so don't get worried about it. So it's a family of statistical and mathematical modeling techniques that uses a variety of approaches to automatically learn and improve the prediction of a target state without explicit programming. That's a lot of words. Let's go step by step, right? So it's a family of modeling techniques, right? So very often we find this word model being thrown around, whether it's, even in our own research papers, you see a lot of articles that come saying a model was used to estimate this, a model was used to estimate that. So what do you understand by the word model is essentially a model in mathematics is a very simple definition is it is something that can make a prediction, right? It's not an accurate definition, but it's for an easy understanding, right? It's something that makes a prediction. And because we are in India, and because this is the most famous example of using a mathematical modeling in India, I think is the Duckworth-Lewis method, which is used in cricket. So if there's any cricket fans here, but this is not a machine learning model. This is a rules-based model, but just to get the picture of what a model is it's something that's used to make a prediction. In the healthcare setting, we also use a lot of models. That is, in an infectious disease epidemiology, there's something called the SIR model, that is susceptible, infectious, recovered model. There are a lot of models that we use, right? So that is the word model. Model is anything that can make a prediction, right? I think we saw during COVID, we saw a lot of models being made saying what is the, what number of cases we can see, what is the estimated this thing. And sometimes when you read that, without context, it becomes kind of scary, because you don't know whether it's true, whether it's not true, whatever. So I think in the context of models, this is a quote that is popularly used. All models are wrong, some are useful. So because it's something that's important to remember, because any model that you use to make a prediction, most predictions will be wrong, but it will give you a sense of direction in which things are going, and it gives you an idea of how things are progressing. So I won't say that they're useless, but in terms of they can be very useful if they're done right. Yeah? So that's essentially that is to understand what a model means, right? So coming back to that long and complicated definition, a family of statistical and mathematical modeling techniques that uses a variety of approaches to learn and improve a prediction. So prediction is also something that we covered, right? So all models can be either rule-based models or non-rule-based models. So traditionally, we have always followed rule-based models, and this non-rule-based is what is now today being called machine learning. And okay, so we understand rule-based modeling because we use it all the time in medicine. Okay, we use this every day in medicine, in the sense that we always have, in all of our research projects, or even in clinical medicine, we have various scores that we use in practice, where we have one input, a second input, a third input, and then you have a formula to calculate the final state, right? And just to drive home a very, very simple thing that we use in medicine, it's something like the Curve 65 score. This is not exactly a model, but it's an example of using this rule-based framework, right? So if you have Curve 65 for your community pneumonia, you have confusion, blood urea nitrogen, respiratory rate, blood pressure, age, and then you have an output to say, whether it is community acquired pneumonia or not. So there is an algorithm, and all of us in medicine are very familiar with the idea of using an algorithm, because this is what we have trained in, this is what traditionally we have always done. So like I said, this is not something that is brand new to all of us. This is something that we have always done. This is how we always practiced our medicine, right? So, but the difference in when we use machine learning is that in this, we have to specifically, in traditionally, we have always had to put in the formula for what it is, right? So you say that these are the variables and this is how I will add it, right? I will say curve score, confusion plus, I'm going to give 1 for this, 1 for this, 1 for this, 1 for this, and my total is going to be 4. So I have a very specific definition of, I have defined my formula by which I am going to put my output. But in machine learning, we don't define the formula at all. We have the outcomes. So what we do in machine learning is that we have a training data set and we have a test data set, where basically what you do is you don't define what the formula is for the last one. You give it, you give that model 50, you give it a large number of, you say this is output 1, output 2, output 3, and then this is, whether it's pneumonia or not. And over time, what happens is the system becomes good enough it will make the prediction for you. So you have given it this complete training set, and then the test set is kind of empty, the outcome is empty. Does that make sense? So here you've fed the model this training data, and this test data, this is blank, but it will kind of figure out its own rules to fill this up, right? So you're not telling that this 44 is 32 plus 26 plus 6. You're just giving it this complete numbers, and over time what happens is that it figures these rules out by itself. So that is, I'll just go a little forward to. So in classical programming, you're giving it the data and the patterns, and it is giving you the answers. Here it is giving you the data. You're giving it the data and the answers in the training set, and it is telling you what the patterns are. So you don't know what the you don't necessarily need to know what the patterns are. I mean, you don't necessarily need to define what the rules are. It is figuring out the rules by itself. Okay, so, and the other thing is that there is feedback also. So traditional models, if your algorithm is such, you're not tweaking your algorithm in any way, because you're not tweaking your algorithm based on how it's performing and whether it's performing right, whether it's making a mistake. The algorithm stays the same. But here the advantage is that there is a feedback kind of mechanism. I know this is a little complicated slide, but there is a feedback mechanism that, so if your model is kind of poor, it takes that feedback and it changes things as well, right? Just to drive home a point of how powerful this can be, is that, normally on fundoscopy, as far as I know, there is nothing on the fundus that can differentiate between male funduses and female funduses, right? But we've seen, this is a paper that was published in 2021, where people have used retinal fundus photographies and told it that this is male, this is female, this is male, this is female. And the model has been, after that, if you give it a retinal fundal, like a fundus photograph, the machine accurately predicts whether it came from a male patient or a female patient. What the pattern is, we don't know. But we know that it can correctly identify whether it is male or female with an 88.6% sensitivity, which is kind of crazy when you think about it, because apparently there is something on the fundus that can differentiate the two, but it's not really known to us. I mean, of course, this is kind of like a study kind of thing, because obviously you don't need to, there's no real clinical utility out of it. But the fact that it can do that is kind of mind-blowing when you think about it, because I think because that's crazy, right? So, but let's be clear that these predictions are not magic. They are based on statistics. And if your training data set is wrong, like if there are errors in your training data set, that is going to carry forward in the predictions that this model makes. So if there are biases and if there is problems in the way your training data set, it's going to the performance of your model is going to affect. So it's the classical definition. What they say, garbage in is, I mean, even if you have the best model that is out there, garbage in is garbage out. So unless you have good data, and unless your data has been collected cleanly and all of that, there's nothing much more that you can do really. So yeah, so again, to drive home that point, so it's traditionally it is data patterns. I mean, you give it the you tell it the rules, but here you don't have to tell it the rules. You just show it the data and the answers, and it tells you what the patterns are. Like, it figures out its own patterns, right? So coming back to that definition again, a family of statistical and mathematical modeling techniques that uses a variety of approaches to learn and improve a prediction of a target state without explicit programming. That is, you're using a model to make a prediction without explicitly laying out what the rules of this prediction are. And there is also scope for automatically improving based on feedback. So that is, I think that that covers that definition a little bit. Okay, so coming to so how do all of these companies use AI? Is like A very simple way is Gmail. If you see a spam folder, how does the system know that some emails are likely to be spam? So that classification, I mean, Google has shown it enough spam that it can correctly predict whether this email is spam or not spam. The other way it uses is it for some autocomplete. Sometimes if you type just hope you are, it knows enough to make the rest of the sentence. So this is actually one way that we use, that Gmail uses machine learning. Netflix, for example, if you have, based on your previous browsing history, it can accurately predict the movies that you're likely to like, so that is how they use machine learning. Again, when it comes to cameras, a lot of the newer cameras that you see, they have facial identification, so they can identify which is the face and light it up a little bit more. So, so that is the, so another thing in this thing is that the data does not necessarily need to be numbers. It can be images, it can be, these inputs that you put does not necessarily need to be numbers. It can even be images, pictures, videos, whatever it is. So that is the other real power that it has. Yeah. So coming to ECG, I mean, coming to actual applications in medicine. For example, all of us, when we read an ECG, the first thing that we are taught is to never look at this part, right? I mean, that is good advice. That is very good advice because there is some, most machines will give you a, potential diagnosis, but more often than not, this is not very accurate, and that's not the way to, I mean, for at least a physician should not be looking at this. I mean, but you need to know how to read the ECG properly without tools like that, because obviously from a physician point of view, you need to know how to read the ECG, right? That's the basic thing. I mean, but if you look at the code that actually writes this, if you look at, so this traditionally all those ECG machines have a rules-based approach, right? So they say if QRS duration is greater than 120, S duration is less than 40. So there is a set of rules that we follow while reading an ECG, and even for those, for the for the machine, the machine is also given those set of rules, and then it tries to make a prediction based on those rules, right? This was the traditional way that most ECG machines have always worked. But if you look at now, you see a lot of, there's a lot of research also going on into artificial intelligence enhanced ECG. So it's basically the same thing that I told you before, but under the hood, it's not a rules-based approach anymore. It is a machine learning approach. So you've shown it enough ECGs that it can correctly make the prediction, right? So I'm not saying it's there yet, but I'm saying that that is something that is actively being researched. So this paper is from 2021, not very long ago. So again, under the, so if you look at how does it matter to us, not really, because what happens is the prediction that comes on your ECG report is likely to improve in accuracy. But does that make a big difference for us in our terms of ECG reading skills? Not so much, but I mean, that's it. If your ECG is coming with a good report, that's not something to be worried about, right? It can only be potentially be a good thing, right? So what has changed is that the mechanism in which the machine is giving you that output has fundamentally changed from a rules-based approach to a machine learning approach, because now it's not focused on the rules of how to read the ECG, but it has, figured out its own rules, and it will also improve and it will get better with, feedback on whether it's right or wrong. So, I mean, when you think about it, it's kind of like how, humans learn, right? So, so that's, ECG is definitely one thing. There's a lot of work being done in terms of early detection of cancers, for example, as screening techniques, whether this lesion is potentially likely to be cancer or not likely to be cancer. Again, radiology, pathology are two fields that have a lot of innovation that has come in terms of artificial intelligence. What is the likely findings? Is it likely to be, a tumor? Is it not? Is it, so those are, again, the same principles of prediction. Is it yes or is it no? Based on previous findings, yeah? So that's, some things that are actually happening on the ground, even in India, I think is Path has a project in which they are using a artificial intelligence tool called, a company called Cure.ai, which is having TB screening in rural communities where, somebody's taking an X-ray and the X-ray is kind of predicting whether it is TB, not TB. So this is being used in public health as well. And this is happening. It's an active project. It's not a imaginary thing that I'm talking about in the future. So again, pathology, there's a lot of work that's happening in terms of, because the thing with artificial intelligence also is that machines are always good at large quantity of work, right? So once it learns how to do it, if you want to process 600 files also, it can do it in seconds, right? So that is the advantage of a, so the problem of scale is not so much for, for a model like this. But again, in terms of accuracy, that is the other question that we have to ask. So, but I think from the few examples that I've shown you, what is clear is that artificial intelligence enhanced tools can potentially be powerful instruments in the hands of a physician, right? It's not something that you need to be worried about that it can replace the physician. I don't think that's likely to happen, but it can actually enhance. I mean, you're likely to see AI enhanced investigations in the near future. So that is something that is definitely likely to be there. So how do you evaluate an AI? It's the same like any older investigation, how you would investigate. It's the same sensitivity, specificity, area under the curve, positive predictive value, negative predictive value that we have discussed from time immemorial. It's not a new thing that, because essentially at the end of the day, AI powered tools are investigations, and so you hold them to the same standard that you would hold older investigations. I mean, you don't keep aside all clinical judgment and all your clinical knowledge and say that AI is the new thing. This is another investigation modality that is likely to emerge in the future. That is, I think, the take home. So what if the AI model is correctly predicting? Okay. The question that we have to ask is, we may have a great model that can pick up, there are a lot of models also that are being used to see whether the patient is likely to go into sepsis in the future or not, or something of that sort, or is the patient likely to develop cancer or not, or, so, but the point is that, if whatever information that it is generating, is it actionable? If it's not actionable, then what are you going to do with that information, right? And also, are you putting yourself at a risk of overdiagnosis? So, if, for example, if you see for CA prostate, there are, I think a lot of guidelines say that, picking up CA prostate very late in life may not really be useful because they don't necessarily manifest, with full-blown symptoms. So again, will prior knowledge of this thing actually change the course of the illness? That is another thing. Or even if we have prior knowledge, if we get knowledge of that this illness is likely to develop, can we change the course? So this is, these are questions, these are the larger questions that we have to ask ourselves. It's not necessarily, the technology will come, but the larger question is, how do we use it efficiently? Or do we have the resources to implement such a AI plan, or what is the risk of harm? Okay, that is another big thing, because with artificial intelligence, you're likely to have so much of investigative knowledge, because AI can do things on scale which are massive scale. It can, it can probably scan all your records for you and pick up findings. So then, what are you going to do with clinically normal people who AI has predicted something that is problematic, right? So again, those are the larger questions, right? So are you going to end up chasing radiological shadows that are irrelevant? So so normally traditionally we discuss number needed to treat, but is there a number needed to harm? You know, are you going to be unnecessarily doing a lot more investigations? What is the cost involved? So these are the, these are the questions that would come, and that cannot be solved by a machine model. That has to come from our own judgment, our own clinical experience. And that is why I really think the core of medicine is not going to, the doctors are not going to go anywhere, because these questions have to be answered with, not with algorithms, but with wisdom and with experience. And, so that is definitely going to be there. Because there are a lot of people in the tech world who think that, medicine is about doing an investigation and getting a diagnosis. But we all who practice medicine know that there is much more to medicine than just investigations and diagnosis, right? So that is the fact. So there is data privacy is again a huge thing when we consider AI solutions, because if you look at the West, there are standards, there's the HIPAA Act, and there are various data protection standards that are there. Health data is extremely confidential data in the West. But here, if you ask for a data set, you will probably get a data set via email or something of that. There's not much, the idea of cybersecurity really has not evolved much in our own understanding, and our culturally the fact that health data has to be treated confidentially is not really understood well in our context. So, but when you have health data, it's extremely sensitive information you have about people. So what are you going to do to protect that data? So that is, again, things that you have to keep in mind. So again, you have a lot of apps today that where you have clinical data of patients being entered online and things of that. There are online counseling apps and consultation platforms. So what happens to the data? Where does it go? Where is it being stored? Who has access to it? Does it get sold anywhere? These are again questions that need to be addressed before we can actually take bigger leaps in terms of technology, because the framework and the legal framework and that has to be sorted first, right? So I think when it comes to being a clinician, I think there are two parts. One is the pattern recognition diagnosis part of it, which I think AI will probably catch up one day. But this doctor-patient relationship part, it has no chance. Okay, so I think that traditionally, classically, the way we have all been trained is that listen to the patient. Girija ma'am's talk was there, listen to the patient, he's telling you the diagnosis. Valuing that doctor-patient relationship, seeing what kind of situation he is in life, what is the, not protocol-based, what is the best for the patient, but, looking at his overall situation and choosing the plan for the patient. Those kind of things are not going to be taken care of. It's probably going to get better at, at core, at identifying certain patterns. It may probably be a great tool, but this doctor-patient relationship is one of the core of, is one of the hearts of medicine. So as long as this is there, I don't think doctors are going anywhere. But of course, there are places where the value on doctor-patient relationships are being downplayed by the medical community itself, which is, if we go down that path and totally lose our doctor-patient relationship as human beings itself, then we are likely to be replaced. But if we hold on to this, then we're not going anywhere, that's for sure. So, if we ourselves as humans try to turn into pattern recognition machines, then that's a problem that we have going to face. But if we focus on this, then the pattern recognition that AI brings is just going to be one more thing in the collection of tools that we have to become better physicians, right? So take-home messages, technology is a means to an end. It is only an instrument in the hands of a physician. It will never be the center of the universe, right? Sometimes when we have a new tech, we try to keep it at the center. All the work revolves around feeding data into that, and that becomes the center of the universe. But the fact is, patient is the center, and problem solving of the patient is the center. If your problem solving should be the goal. I mean, if technology is going to help you in that, then that's absolutely the best thing. But if you know, if you're keeping the tool at the middle, then that's not going to be this thing. Again, focus on problem solving. Technology can help, use it. But if it is not going to help, if it is just one added extra thing, then there is no point in chasing that technology. All of these AI ML models cannot work in isolation. They have to be, all technology is part of a human system, right? Like, even if you have the best informatics system, for example, unless you have people who use it, interact with it, engage with it, you know, there are specific people for specific roles, it's not really going to be efficient, right? So the same thing holds true here also, right? It's not necessarily the input out, the prediction that it makes. It's about what you do after that, what you do before that, who are you applying it to. So these are all things that you know, that need very human decisions. So I think that's the take-home message that we have. So I think. I guess perhaps some of it might have gone over, but at least if, you know, 70% of that talk was comprehensible, then I think I've done my job. Yeah.
Thank you, Deepak. That was a wonderful talk. Questions?
Good morning, Deepak. I resonated with many of your messages. It was very nice. No, I was just I wanted to tell the audience something. Yesterday, I was suddenly asked to take a class on growth and development. And they said, ma'am, you just go and sit there. The students will do everything. So the student was telling me all the formulas, how to calculate weight in a child. What is the height in a child from birth to puberty. So formulas came in, and I understood that these are the formulas which I have learned also. But today, at the age of 60, I'm sitting in my OPD. I don't need formulas to know the weight of a child till 5 years, because it's very easy. Dr. Girija Madam will say, birth weight 3 times 1 year, birth weight 4 times is 12 kg. After 12 kg, it is 12, 14, 16, and 18. If I'm going to use a formula, my brain is not going to accept this, because I found it very tedious. It's much easier to remember 12, 14, 16, and 18 rather than get a formula to do it. Same thing for the height also. We all need to know, Dr. Philip Finney just left, we all need to know that we must grow 6 centimeters per year to see if your hormones are right. So when you do this in daily life, we have learned so much. But after 60 years, my head is full of information that I've forgotten most of the formulas. So we just need to remain simple. Basics we should not leave. What is happening now is, because of artificial intelligence, we feel that we must use SSPS and the Excel formulas, but we don't need. We just, for our daily living, we only need simple facts. We don't need to look at the fundus to make out whether the child is male or female. Why not wait for 280 days? Why do you want to know it early?
No. Yeah.
Why do you make life so complicated to see the size of a fundal photograph and then see the male size of the vessel and the female and then decide? Wait. So what is happening now is we lack patience. So if we can be patient, see what our eyes show us, what our ears tell us, and what our nose can smell, many diagnoses can be made. Basic is basic. Thank you.
Yeah. I think just wanted to clarify that fundus image was not meant for diagnosing male or female. Obviously, there are easier ways to do it. No, but this was, the study was essentially to show that it is capable of discriminating between male and female. Yes. But thank you. Well, I think the focus on basics and the focus on clinical medicine is never going to go away. Yes, that is very true. I could. Yeah, diagnostic accuracy. Yeah. Yeah, diagnostic accuracy is likely to go up, but the thing is, are we going to end up over-diagnosing is the other challenge. But of course, I mean, yeah, diagnostic accuracy is likely to be helped, yeah, perhaps.
I just want to make a comment on what Dr. Elizabeth said. So, Dr. Elizabeth, I just want to know. So, you said that a child grows, how? How did you say? At? 3 times at? Okay. Okay, that much information is enough for me. So, birth weight becomes 3 times at 1 year. How did we know this? Exactly. So, initially also, that's what we were doing all these years. We have been using statistics to make this conclusion that 3 times later, that the birth weight becomes 3 times more at 1 year, right? This is exactly the same thing that is being done in artificial intelligence. It's the same statistics only, except that they are using a much larger data set. So instead of saying 3, they may say 3.00056. That is the difference. And because it is becoming so accurate to the 10th or the 50th digit, they are able to make very good predictions, very accurate predictions. The second thing is, to make a prediction, we have always been using what we know, all right? Whatever we know. For example, we have been using like heart disease is caused by age, gender. You know the score that we use, what is the name of that score? I forgot. Whether they smoke or whether they, not Apache score, for heart disease, what is it? Anyway, we have multiple scales, right? And all those scales we have been using when we have certain things that we already know, like do they smoke, do they drink, what is their age, what is their gender, based on all these things. But what artificial intelligence is doing is that it's doing the same thing, but it's also including so many things that we don't think about. That is why it is taking from the image. So it is looking at, for example, a slide from your whatever blood smear, and it's taking a lot more information than what we already know. And from the image it is capturing and converting it into numbers and doing the same regression and coming up with the numbers. And how? And machine learning means it is actually, so when we do regression, we decide, okay, should I do logistic regression, should I do linear regression, depending on so many formulas that we have. But machine learning, first of all, as Deepak clearly said, it is not the normal programming that computer programmers are used to. Computer programmers, they have, if this, then do this. That has always been there. But statistical regression has never been like that. Statistical regression does not say if, then do this. It looks at the pattern and comes up with a model. But even then, when we do the model, we decide, okay, I'm going to do linear regression or logistic regression. But in machine learning, the machine itself decides, okay, I'm going to do this regression. So those kind of fine-tuning of statistics help us to get very accurate information. And the scales that we already have now will become more and more accurate. That's what it is.
Our hospital, we are using continuous glucose monitoring. Patient can monitor in the mobile the pattern of fluctuation glucose level. So we rectify the finest things in the glucose elevation and decrease, like hyperglycemia, hypoglycemia, and all they can see.
Yeah, that's.
I don't deny what you say about the human race has to become better, not worse. Balance and moderation. I am not right, you are not right. Let us have a balance and moderation. Use calculators when necessary. But in day-to-day life, we only need little information. So balance and moderation is the averages. Thank you very much.
Thank you, Deepak, for that showing us the Deepam to artificial intelligence and machine. I went through so many articles to find out what is the difference between, with my little knowledge on the subject. So I'm so happy that I now know what is the difference between AI and ML. Thank you so much.
Thank you, ma'am.
If there are no more questions, we'll conclude the session. Once again, let us put our hands together and appreciate our dear Deepak for this very clear elucidation of what artificial intelligence in healthcare is, what its implications and future of healthcare. And I see a lot of relieved faces that it's not going to take our jobs, and it's in fact going to enhance what we do and how we do. Thank you, dear Deepak. So have a wonderful day ahead. Thank you all for coming.
Thank you.